If your CPAP mask is leaking and keeping you up all night, you don't have to live like this. And you might not even need a new mask. You might just need to follow some simple tips and tricks to fix your mask seal. My name is Narina, and I'm a respiratory therapist and sleep coach at Empower Sleep. Today, we'll be talking about common causes of mask leakage and solutions. Let's get started. Now, while leaks are pretty common and easy to fix, you might be wondering, why is a good seal so important? Well, there's a few things that can occur when you don't have a good seal. One of them being really bad discomfort with your CPAP pressures. Now, if you're on auto CPAP, your device follows an algorithm where it will automatically increase and decrease pressure based on how severe your airway blockage is. When you're on auto CPAP and you start having a high leak, the device will think that it's doing the right thing, and it'll actually increase the pressure to compensate for the leak that you're experiencing. In theory, that sounds wonderful, but in practice, what that means is that you're up at night dealing with a mask leak that's only getting worse because the pressures are increasing. So that's reason number one. Now, reason number two goes hand in hand. There are issues with mask leakage causing lots of noise. We don't want the CPAP to be super loud in the middle of the night because we're not interested in replacing snoring with the sound of a machine. Additionally, dry eyes and dry mouth are very common with mask leaks. So it's important that we mitigate or treat these mask leaks entirely, so that way any sort of issues with dry mouth, dry nose, dry eyes, all of that can resolve itself. Let's review the common causes of mask leakage. There are 5 main causes. Number 1, your mask is too loose or too tight. Number 2, your mask is not the right size, the right shape for your face, or possibly the way that you need to breathe at night, whether that's through your mouth or your nose. Number 3, facial hair, possibly your body position at night, or even your pressure from your pillow at night kind of pushing up against the mask and breaking the seal. Number 4, worn out cushions or mask parts. Number 5, skin oils or sweat throughout the night. Now let's talk about the first cause of mask leakage that we touched on, which is the mask being maybe a little too loose or even too tight. Now, how does that work? Especially on auto-adjusting CPAP, you might notice that as the pressure increases, your mask leak worsens. And that's really common when the mask is not cinched down quite enough and the pressures are actually trying to blow the mask off of your face. This might sound like a little bit of vibrations on your face, or the mask might feel like it's pulsing in the middle of the night. So we need to address that. Now, with the mask being too tight, there's also an issue where if we go ahead and we have this mask compressed up against our nose, as soon as the mask becomes too tight, all of that soft portion of the cushion goes into the mask, and we are now left with a hard piece of plastic up against our face. Not only is that very uncomfortable to have that hard plastic against your face, but it allows room for air to seep out. So it's very important that your mask is not too loose or too tight, as this can cause mask leakage. Now, the second reason that we discussed as a cause for mask leakage is that maybe the mask isn't the right size, or it's possibly just not right for you based on how you breathe throughout the night. When it comes down to mask sizing, it's really important that we have the right fit. Typically, in the mask that you receive, there will be a sizing guide that you can hold up to your face to gauge which size would be best for you. Now, regarding the way that you breathe, it's really important that we find a mask that helps you breathe comfortably, whether that's through your nose or through your mouth. When it comes down to picking out the perfect CPAP mask, I usually recommend trying to gauge how you're breathing during the day when you're at rest. If you are comfortable using just your nose to breathe when you're not exerting yourself, maybe reading a book or even watching this video, then I would recommend going into a mask that is a little bit smaller and maybe one that doesn't cover your mouth, versus I would recommend a mask that covers your mouth if you are using your mouth to breathe during the day. Now, at the same time, if you are a CPAP user and you are struggling with your nasal mask and you would wish that you had a way to use your mouth to breathe because your mouth opening is causing you to wake up at night, then it might be a good idea to switch over to a full face mask that allows you to use your mouth to breathe. Now, the third cause of mask leaks, I kind of lumped up into one thing. There could be issues with facial hair, your body position at night, and even your pillow causing your mask to break the seal. When it comes to having facial hair, if you have a mask that covers your mouth or maybe even rests on your upper lip, you might have issues where the mask is just not sealing properly in those areas. We either have to try to find a way to completely avoid those areas. We can move from a silicone to a memory foam mask that allows a little bit more of a good seal with facial hair, since the memory foam will mold to the facial hair a little bit better. And when it comes down to sleeping position, if you're a side sleeper and you're running into issues where maybe the mask is kind of pushing up against your pillow and breaking the seal, it might be a good idea to get a CPAP pillow. The CPAP pillow is the pillow that you rest your head on at night, but it has these cutouts on the side so that when you move from side to side, the mask is not actually impacted by the position of your pillow. Number 4, worn out mask cushions or mask parts. If your mask cushion is really worn down, you might have an issue where it no longer keeps a good seal against your face. If it's a little flimsy, we know that air can seep out of those worn out cushions. Even the headgear being worn out can be a bit difficult. When you have a headgear that's worn out or overstretched, you might notice that you're now positioning your straps really far back on your head, or maybe they're overlapping. And in that case, that would cause you to over-tighten your mask and possibly prompt more leakage. And last but not least, number 5, facial oils or sweat throughout the night. Now, when we deal with facial oils or sweat throughout the night, what can occur is that the mask can have a slip and slide effect, as well as possibly breaking out. So it's really important that if you do know that maybe you have a little bit of an oilier face, you should go ahead and utilize some face wash every night, moisturize, and also make sure that your mask is being wiped down on a daily basis to avoid any sort of oil buildup, and then cleaned once a week with soap and water. If you do experience a lot of sweat throughout the night, you may benefit from mask liners or possibly an air touch cushion or memory foam to absorb that sweat. Now that we've talked about common causes of mask leakage and touched a little bit on solutions already, I just want to go ahead and recap that. We definitely want to keep washing our face on a nightly basis and moisturizing, as well as cleaning your mask supplies with warm soap and water once a week and wiping down your cushion on a daily basis. Aside from that, we do want to check the cushion and headgear for wear and tear. The entire mask should be replaced every 3 months, including the strap, whereas the cushion or the soft part that makes contact with your skin should be replaced on a monthly basis. Number 3, we have to adjust the straps evenly. We will be going through a demonstration on how to fit these masks, but it's very important that your straps are adjusted evenly. Having one strap or one side maybe overly tightened, whereas the other side is a little loose, can cause leakage on one side versus the other, or maybe even pain on those portions that are a little too tight. Now, if we need to use a CPAP mask liner, we should. And a CPAP mask liner is going to be a little piece of fabric that would hug your mask cushion. And so when you put the mask on, we're going to have a barrier between the mask and the skin. Not only can this help with mask lines or irritation on your face, but it can also help mitigate leakage. And last but not least, we do want to try alternating our sleeping position or even getting a CPAP specialty pillow. So that way, if you are somebody that enjoys side sleeping, you can get that part of your life back. And you don't have to, deal with mask seals in certain body positions. And maybe even a different mask style that allows you to sleep in certain positions might be better for you. When do we get help? If you followed these steps and your mask is still leaking, it's probably a good idea to reach out to your provider, whether that's your doctor or your respiratory therapist. They might ask you to refit your mask or even suggest possible pressure adjustments that could help with this. You don't have to do this alone, and you're not alone, so please reach out if you need us. Now, you might be running into issues where you're like, hey, I have a great mask seal, but my machine keeps giving me high leak alerts. There are 2 things that I want to discuss in particular that could be contributing to a high leak alert message. Number 1, your humidifier is not plugged in properly. Now, if I don't have my humidifier pushed in all the way to where these rubber gaskets on the humidifier and in the machine are not aligned, what we'll notice is that the device will still turn on, but it'll shut off right away. Too loud. Your machine should never be that loud. And if that is the case, and maybe your humidifier is pushed in all the way, it's recommended to remove the water tank and slightly angle it downwards. And at that point, your gaskets should be aligned and you should no longer have issues with that high leak alert. If it's persistent, there's one more place to check. It's your air inlet adapter, and it's where the tubing plugs into the back of your machine. So I'll go ahead and remove my water tank. And in my machine, I'm going to press down this little notch here and remove this part. And all I'm going to do is reinsert it until it clicks. And that should resolve that issue. When trying to resolve mask leaks, my first line of defense is something that you can actually do on the machine called the mask fit test. On your AirSense 11, this is located in your More menu, and it's the second option down labeled mask fit. The concept behind this is you can try to mimic your body positions that you experience throughout the night and have the pressure fluctuating up and down as it would in the middle of the night to really test if you have a good mask seal before bed so you're not fighting with it in the middle of the night. And so in order to get there, we're going to hit More, Mask Fit. And at this point, I would recommend that you have your mask on and you get cozy in bed in your favorite body position. Usually I have people start by laying down on their back. If you have if you sleep in a recliner or anything like that, please feel free to do that in your natural sleeping position. But you'll go ahead and place your mask on. Following that, you'll press start. And the test will give you a green check mark or yellow exclamation point to let you know whether or not you have a good seal. It's recommended that you leave the test running for at least 15 seconds to assess whether or not you have a good seal in that body position. Now, if you know that you move around at night, it's probably a good idea to then turn onto your sides. Try to mimic your sleep position as best as possible. If that means your hands are under your head or your hands are between your knees or anything like that, go ahead and do that position while the test is running so you can make those adjustments when you're awake versus in the middle of the night. Now that test is going to look something like this. I want to demonstrate without a mask attached first, just to kind of give you an idea of what the screen will look like. So we'll go ahead and hit start. I'm going to mimic a good seal with just the palm of my hand. And here we'll see that we have a great mask seal. But when I let go of that fake mask seal that I made, it also lets us know that we have to now adjust the mask seal. So pretty cool. Now let's get started in practical ways to use this. In front of me, I have essentially every type of mask style. We'll start with the nasal pillows since those are usually the most common. And I don't really use the mask fit test on a nasal pillow, but I do want you to understand how to know whether or not you have a good seal on the nasal pillow. Now, on a nasal pillow mask, this is characterized by these two little cones that would rest beneath your nostrils to direct the air straight into your nose. If you feel irritation inside of your nose or you feel air seeping out of your nostrils, it's a really good idea to size up. You should never feel irritation inside of your nose. That just means that it's going too far up and causing a bad mask seal. Now, if you do the mask fit test and you notice that you can keep a good seal or you don't feel any air seeping out of the front, but you are noticing a bad mask seal, it's a really good idea to make sure that your mouth is closed while the test is running. When you use any style mask that does not cover your mouth, but your mouth is open, you will have a bad mask seal due to the mouth being open. So I don't usually do a mask fit test on this. You should be able to gauge whether or not you're keeping a good seal based on the airflow, if you feel any airflow coming out of your nasal passages. Nasal cradles are similar. Nasal cradles don't have the prongs that go in your nose, but they lay flat underneath your nose. Nasal cradles, I kind of talk about them like they're a little hammock that's going to be hugging or pressing up under your nose. And with nasal cradles, we also recommend just nasal breathing. Any sort of mouth breathing with this mask on will cause poor leak outcomes and likely that dryness that we talked about earlier. When it comes down to the nasal cradle mask, it's really important that we have a good seal under the nose, as these can sometimes slip and slide around at night. So when I put my nasal pillow mask on, I shouldn't be able to see any visible gaps between my mask and the nose. If you can see a gap underneath your nose, that is a gap that air can seep out of. So I would recommend using your sizing guide and seeing where your nose lines up in the guide. And then from there, completing the test. If you're feeling air leaking out of the sides of your nose, it might be a good idea to try to tighten the mask. However, if tightening doesn't do the trick, you might need to go ahead and change out the size. This is a traditional nasal mask. This covers the nose completely, including the nasal bridge. So kind of like a little bubble that covers the nose. Some things to note about these styles. They do have a sizing guide so that you can see which size fits you best by holding it up underneath your nose. Now, in this instance, if the mask is too large, it might feel like it's going above your nasal bridge and it's almost sitting on your forehead. Or maybe it's really wide across your face. And so when you're trying to tighten the mask, it might tighten and kind of shoot up onto your forehead. Now, if it's too small, you might notice that it's compressing your nostrils closed or restricting your airflow. Or it might be so small that the plastic is sitting up against your nostrils and not allowing you to breathe in. Something that I see pretty often as well is that the mask is sitting too low on the nose. So some people think that their mask should be sitting down here, but this is kind of where our sinuses are. So it can start to impede on your sinuses and again, restrict airflow, which may actually result in a higher AHI or apnea-hypopnea index. When putting this mask on, this one is a little too large for me. But when I wear it, I'm going to completely remove my clasps and then put the mask on. Now, once the mask is on, the way that I like to fine tune my fit is to pull the Velcro on both sides. You can either start with the 2 top straps or the 2 bottom straps, but I want you to really focus on making sure that it's actually going to be like an even adjustment. So we're going to focus on adjusting the top or the 2 bottom straps. So I pull away, cinch down, and then lay my straps on. And then I will do the same for my top straps. Now I'm going to actually mimic a bad seal. So I'm going to keep my mask really, really loose. And so when this mask fit test is running, it will detect a high leak and let me know. So I'm going to go ahead and press start. And there is air blowing into my eyes and all sorts of discomfort. Now, our next mask up is going to be a hybrid full face mask. Rather than the traditional that covers the mouth and nose, a hybrid full face will cover your mouth and go under your nose. This is great for people that are a little bit more active in their sleep, or maybe there's some claustrophobia or like a panic disorder involved, or even PTSD, where having something on your face might spark some anxiety or discomfort with therapy. Now, again, this is also made for people that use their mouth to breathe at night. When I'm applying a hybrid mask, we want to stick to a similar concept as the nasal cradle. We don't want to see any gaps underneath the nose, between the mask and the nose, because that's a gap where air can leak. So again, I will start by removing both of my magnets, because if I try to put my mask on like this, it might be a little crooked and not really keep a good seal. So I'm going to remove both clasps. On any styles with the tubing at the top of your head, you want the frame to kind of be sitting in between your eye and your ear, so right here on your temple. Otherwise, if this part is sitting too far back like a ponytail, your mask will be kind of pushing your nose upward. And if it's too far forward, it's going to be scrunching your nose. So we need it in the perfect place. And then from here, something important to know about full face masks. The bottom portion that rests on your chin should be right in that dip in your chin. If your full face mask is completely covering your chin, it is too large, or you're pushing it too far down. Another rule of thumb that I like to follow on the full face masks is that you can fit 2 fingers between the mask and the skin. So where it's resting up against your jaw, you should be able to fit 2 fingers. If you cannot, that means that the mask is too tight and will likely cause lots of discomfort in the middle of the night. That could result in jaw pain because it's tight on the jaw, could even give you neck pain because it's moving your neck forward. Having it overly tightened on your chin area could also result in pushing the neck in and inducing more apnea. So that's why over-tightening is really not a good idea. You could use this test on your device if your mask feels too tight to slowly loosen both your bottom straps and top straps, whatever you feel is kind of bothering you. If it's more of the nasal bridge, maybe the top straps. And if it's bothering you at your chin, you can do the bottom straps. But you can see how far you can tighten or loosen to keep a good seal. So even if it's, hey, I have a great seal, but it hurts my face, maybe using this test to actually loosen the mask would be a good idea. Now here we have a traditional full face mask. This one covers the mouth and nose completely. And so with this mask, it should be resting on the nasal bridge, right in that dip in your nose. We shouldn't have it resting too far or too low, because then the mask will sit too low and it'll impede on your sinuses. And if it's resting too high, then the mask is going to go into your mouth. So that won't be super comfortable. If your mask does not fit properly in this area of your face, that means that we need a different size. So again, removing both my magnets, placing my mask on. There we go. Now we will go ahead and tighten. And voila. Same rule here. 2 fingers should fit between the mask and the straps and your jaw. And there you have it, ladies and gentlemen. That is how to fit your mask, how to troubleshoot your mask leakage, and hopefully this was informative. If you're still running into issues, this would be a great time to chat with your provider so that we could go ahead and see if maybe there's a pressure adjustment that we can make to make the leakage better for you, a different mask style, or possibly even both.